My name is Saru Jayaraman, and I've been organizing restaurant and other service workers for the last 20 years, along with teaching and writing about the service economy. With the pandemic, we have seen massive devastation of the service sector and the millions of workers in it. But it's important to understand that the crisis facing these workers preceded the pandemic. Prior to the pandemic, the restaurant industry was one of the largest and fastest growing private sector employers in the United States of America. It was almost 14 million workers, meaning 1 in 10 Americans worked in restaurants prior to the pandemic. But it was also the lowest paying, so that every year the US Department of Labor would put out a list of the 10 lowest paying jobs, and every year the 7 lowest of the 10 were all in one sector, the restaurant industry. And that was largely due to the money, power, and influence of a trade lobby called the National Restaurant Association. We called it the other NRA. The other NRA, as it turns out, has been around for 150 years since emancipation of slavery, when it first demanded the right to hire newly freed slaves, not pay them anything at all, and have them live entirely on a newfangled concept that had just come from Europe at the time, called tipping. In Europe, tipping was always an extra or a bonus on top of a wage. But when it came to the States, because of slavery, the restaurant lobby demanded to mutate tipping from being an extra or a bonus to becoming a replacement for wages, to be able to pay Black people nothing at all and have them live entirely on tips. That idea became law in 1938 as part of the New Deal, when everybody got the right to the minimum wage for the first time, except for 3 groups of Black workers: farm workers, domestic workers, and tipped restaurant workers who were told, you get a $0 wage as long as tips bring you to the full minimum wage. And we went from 0 in 1938 all the way up to $2.13 an hour, the current federal minimum wage for tipped workers in the United States of America. Today, 6 or 7 million tipped workers out of that total universe of close to 14 million restaurant workers have worked for as little as $2 in 43 states in the United States. 43 states have a sub-minimum wage for tipped workers, and 40 of those states have a sub-minimum wage that is under $5 an hour. In those 43 states, 70% of tipped workers are women. They are disproportionately single mothers and women of color working in casual restaurants like IHOP and Applebee's, and struggling long before the pandemic to feed their children and themselves. These women suffered from the highest rates of economic instability and sexual harassment of any industry because they had to tolerate inappropriate customer behavior to feed their families in tips. Meanwhile, there were 7 states, including California, that have required a full minimum wage, what we call one fair wage, with tips on top, for decades. These states have had higher restaurant sales per capita, higher job growth in the industry, higher job growth among tipped workers, higher rates of tipping. People tip better when they are paid better. And perhaps most importantly, these workers in California and the 6 other states with one fair wage have had far less poverty rates and 1/2 the rate of sexual harassment in the industry, because it turns out when you pay a woman an actual wage rather than forcing her to live off of tips, she doesn't as dependent on the customer. She doesn't have to put up with as much from the customer because she can count on a wage from her boss like every other worker in every other industry. That was all prior to the pandemic. With the pandemic, about 6 million of these workers lost their jobs, and 60% across America were told that they couldn't qualify for unemployment insurance. In most states, these workers were told that their sub-minimum wage of $2 or $3 or $4 an hour, depending on their state, was too low to meet the minimum threshold to qualify for benefits. This resulted in mass starvation and destitution among millions of restaurant workers nationwide. My organization started a relief fund for these workers, and within weeks, 228,000 workers applied, telling us that they couldn't put food on the table, that they couldn't pay their rent, that they couldn't feed their children or pay their bills. It's been a massively heartbreaking devastation at scale. And as these workers return to work, many of them unwilling to do so, but having no choice, As they returned to work in the summer and fall of 2020, they were faced with very dangerous circumstances. In September 2020, the CDC named the restaurant industry the most dangerous place to be, saying that adults were twice as likely to get COVID eating in a restaurant. Imagine working in a restaurant. We surveyed 2,000 workers in restaurants in the summer and fall of 2020. About half said that at least one person in the restaurant that worked had gotten COVID, and a third said that somebody had died. 90% of workers said their employers were not following proper safety protocols. 60% said that they could not enforce social distancing and mask rules because tips were down 50 to 75%, and they had no ability to ask the customers to wear their masks or sit 6 feet apart when they desperately depended on every customer for tips to make up their base wage. In other words, the subminimum wage for tipped workers became a disincentive for workers to do what we desperately needed them to do, which was to enforce these public health rules in the most dangerous location in the United States. But most egregiously, most outrageously, 41% of workers reported that sexual harassment went way up during the pandemic. Hundreds of women submitted comments from male customers saying that these women should remove their masks so that the men could judge their looks and therefore their tips on that basis. We recorded hundreds of comments. Take off your mask so I can see how cute you are and decide how much to tip you. Take off your mask so I can know whether I want to take you home. Take off your mask so I know whether to stick my tongue down your throat. These are actual comments that were submitted by women servers that they heard from male customers. The phenomenon became so frequent, so prevalent, that we actually termed it masculine harassment. Women being asked to remove their masks for a chance to earn a tip. And because we relied on these workers to enforce these rules in the most dangerous location during the pandemic, they became essential. But they were the only essential service workers to not receive a minimum wage, and the only essential workers being asked to remove their protective gear for a chance to earn their income. This is why during the pandemic, thousands of workers started rising up demanding that they wouldn't go back to work without one fair wage, a full minimum wage with tips on top. And hundreds of restaurant owners approached us saying that it was time for change. We heard from hundreds of restaurant owners who were moved either because they saw their workers not receive unemployment insurance because of the subminimum wage, or they were moved by the murder of George Floyd to want to move away from a literal legacy of slavery, or frankly, they couldn't get their workers to come back to work in a very dangerous setting without paying them a full minimum wage with tips on top rather than replacing the wage. So we worked with hundreds of employers, independent restaurant owners, to change their practices during the pandemic, to move to a full minimum wage. But ironically, while thousands of workers were calling for one fair wage and hundreds of independent restaurant owners joined forces with them, legislators have been slow to follow. In multiple states, there is legislation moving to eliminate the subminimum wage for tipped workers, but none has actually passed as of yet. And now, with the Senate in a different place, Congress is considering the Raise the Wage Act, which would fully eliminate the subminimum wage for tipped workers and raise the overall wage to $15 an hour. We have been uplifting the voices of these workers to say what was a subminimum wage that was a racial, economic, and gender justice issue has now become an issue of life or death, with essential food service workers being asked to expose themselves and their families to the virus for the chance to get a tip. It has come time, long overdue, to pay these workers a full minimum wage. And one might ask, what does this have to do with me in California? Our workers here get paid a full minimum wage. Do we really care what's happening at the federal workers or to workers in Arizona or New Mexico who are paid $2.13 an hour? The problem is that as long as there is a sub-minimum wage in the United States, as long as workers have been suffering during this pandemic with starvation and then the life-threatening request to remove their mask to earn a tip to supplement that $2 wage. As long as that exists anywhere, it is a threat to all of us in California. Industries have been attempting to replicate this subminimum wage, and even the California Restaurant Association has been advocating during the pandemic for the wage to go back down in California to a subminimum wage. We saw with the passage of Proposition 22, the gig companies attempt to replicate or emulate the idea of a subminimum wage. Many of these companies like DoorDash and Instacart actually deducting their workers' payments by the amount that they get tipped by customers, exactly replicating the idea of a subminimum wage in the restaurant industry. And as we've seen more and more sectors attempt to replicate the subminimum wage, we've also seen, even here in California, that there are subminimum wage workers across many sectors. The tipped subminimum wage sector is the largest sector of subminimum wage workers, but gig workers also receive a subminimum wage. Workers with disabilities receive a subminimum wage here in the state of California. And perhaps the most egregious, incarcerated workers receive a subminimum wage because of the exception to the 13th Amendment that allows for slavery in the case of incarceration. In 2020, when wildfires raged across the state of California, 1/3 of our firefighting workforce was incarcerated, paid less than 50 cents an hour to do the dirty work of stopping wildfire spread in the state of California. All of this points to a disease that existed, a pre-existing condition that existed in the United States and in California prior to the pandemic. The notion of a sub-minimum wage that frankly treats some people as subhuman. Tipped workers are largely women, disproportionately women of color. They get a $2 wage. Workers with disabilities have a disability. They have, since the inception of a minimum wage, received a lesser wage than others. Incarcerated workers are disproportionately Black and brown. They have received a subminimum wage since slavery times. And youth in many states receive a subminimum wage. Gig workers are overwhelmingly immigrants and people of color. They have been left out of a minimum wage. Ultimately, it is time for both California and the United States to determine once and for all that all human beings deserve a full, fair, livable minimum wage. After all, that is what the notion of a minimum wage was to begin with, the idea that nobody earns less. If anybody earns less, it is because they are valued at less. And it is time for America and California to grapple with our various legacies of slavery and pay one fair wage to all workers now.